Victor. Uh, Awesome. So welcome everyone. We're really glad to have you all here. We're with Family Violence Project. I'm Michelle, I'm an advocate, and this is Victor, also an advocate. We'll be talking about LGBTQ plus partner abuse. We know that this can all bring up some really hard excuse me, emotions and feelings. So please do whatever you need to do to take care of yourself, and know that our helpline is there 24/7 for anyone to talk to and get support. And we have everyone's cameras off for now because this will be posted to YouTube, but feel free to stay on and ask questions afterwards. And I'll hand it over to Victor.
All right, folks, so we're going to get started with a little bit of definition. You may have heard the acronym LGBTQ plus before. We just want to make sure that everyone knows exactly what this means before we get into the bulk of our discussion. So it is an acronym standing for lesbian, gay, bisexual, transgender, which includes non-binary folks, queer or questioning folks, and all other identities. Sometimes when folks do this training, they might go through and define what each of these terms means. These identities are really personal and very, how people relate to them from person to person. So I'm not going to give definitions. Just want us to be aware of what those particular words are. Two other terms I do want to bring up that might come up throughout this that you might hear otherwise are cisgender and heterosexual. And those terms just mean a cisgender person is someone who identifies with the gender they were assigned at birth, and a heterosexual person is someone who's attracted exclusively to the opposite sex or gender. So with those definitions out of the way, we can get into the bulk of what we're talking about today.
So when we look at statistics, we often look at a very binary version of statistics of, domestic violence happens to 1 in 4 women and 1 in 7 men. It's important to break this down because we know that this happens to a lot of different people and a lot of different groups at different rates. We know that domestic violence, depending on who you are, what your identity is, can look different and can affect you in, statistically different. You may be more vulnerable, more likely to experience domestic abuse. So when we're looking at domestic violence in the LGBTQ plus community, we know that those rates are higher. This shows that around 44% of lesbian women and 61% of bisexual women have experienced forms of rape and physical violence by an intimate partner, as opposed to 35% of straight women. Those levels are so much higher. And so just maybe pause for a moment and think of why that might be. We know that we know that people are targeted sometimes because of their gender. I think of people who are bisexual, they may be punished by the person of the same gender or the person of the other gender, but just because of being bisexual and the ideas of what it means to be bisexual, maybe they're saying because you're bisexual, you're promiscuous, and that gives me the right to hurt you because of that. When we know those entitlements are things that people make up in order to use abuse. When people are experiencing abuse, it's not because of who they are or who their identity is, it's because of the person who's choosing to use that abuse. So we always want to, even though we know these statistics are higher, it's not because of who they are, it's because the person who's using abuse feels entitled to do that, but maybe because of their identity, because of their partner's identity. Either way, it's not a choice. No one's choosing to experience abuse. And there's nothing about them that makes them, able to be abused more. We just know it's belief systems of people who use abuse are there, which is really unfortunate. And we know it creates more danger for people. We know that 26% of gay men and 37% of bisexual men have experienced forms of rape and physical violence, as opposed to 29% of straight men. And we know folks who identify as transgender experience increased rates of violence as well. And then when folks have another vulnerability or oppression against them, so that increases the rates too. So we have here that Black and African American members of the Q plus community are more likely to experience physical violence as well. So layering those oppressions, it also layers the ability of people to access support. It creates barriers just to support, which could make them more vulnerable also. I apologize. I'm getting over a cold, so my voice is a little crackly. Sorry about that. And anything you want to add to that, Victor, feel free.
So there may be the question of why are we doing this presentation in particular? Why are we focusing on LGBTQ plus partner abuse in particular and not, grouping it into our sort of foundations or one-on-one training? And the reason is because that this is something particular and different. Like Michelle said, it's not that folks who are in this community deserve this violence or there's something in them that predisposes them to violence, but that folks have experienced and are continuing to experience systematic oppression. And so the ways that they are able to form relationships, be open about their relationships, and access resources are different than people who have not been marginalized and oppressed in the same way. And what do we mean by that systematic oppression? So I'm just going to give you a very brief history here. Illinois became the first state to decriminalize homosexuality in 1961. Prior to that, there were individual laws on the books on individual states that criminalized homosexual or same-sex behavior. Executive Order 10450, signed by Dwight Eisenhower, made it illegal for homosexuals to work in the government. That included folks who worked for a third-party entity that was contracted by the federal government. So if you were discovered to be homosexual, you would be fired on that basis. It was not altered, and that provision was not removed until 1995 by Bill Clinton, and it was not taken officially off the books until 2017 by Barack Obama. The HIV/AIDS crisis, the numbers are hard to get because they weren't recorded properly, nor were they recorded on the basis of sexuality. But in the 1980s, when HIV and AIDS became a disease that the public were aware of, the administration at the time, Ronald Reagan, refused to discuss it, refused to discuss homosexuality at all, and millions of people died as a result of not getting proper treatment. And there were a lot of biases, especially by medical professionals, about who was getting this disease and what it meant about them, which also meant that people were slowly dying by themselves, and thus fostered a distrust among some folks within this community of medical professionals in the system, which is another reason we're talking about this specifically today. Same-sex marriage was first legalized by Massachusetts in 2004 and nationally in 2015. So it was only 8 years ago that many people were able to legally marry their partners. And then there are current legislation and actions being taken nationwide, state to state, that are preventing Q plus folks, especially transgender folks, from accessing proper gender affirming and life-saving care. Bans on hormone replacement therapy, certain kinds of surgeries, that sort of thing. So we really want to emphasize that this is not something that happened a really long time ago and should not be affecting anyone anymore, but that this is oppression that's happening here and now and really affects how Q plus survivors are able to reach out for resources and get help. So we'll look at the power and control wheel. Michelle will look at the power and control wheel.
Thank you, Victor. And so I put it in the chat, or we'll make sure you have this again as a handout. So we have used the power and control wheel in the domestic violence field, for ages. This one has been updated to reflect the experience of LGBTQ plus survivors, because, the tactics may look similar, from the outside, but if you look deeper, the experiences of survivors may be different because of their LGBTQ plus identity. We know that some of those things may be outing their partner. Again, like it's 2023. We feel like, maybe this shouldn't be an issue, but it is. And the choice to come out to your community, to your coworkers, to your family, that should be a choice that an individual makes, not that someone else makes for them. So their partner may be holding that over their head of, if you don't do this, I'm going to out you to your boss. And as Victor said, those oppressions that have been historic, those still carry through, unfortunately. And when we think of small town Maine, someone may not feel safe coming out to their workplace. Someone may not feel safe because of those things. And either way, at the end of the day, it should be their choice when and how they do that. So that can be something that their partner could use is, if you don't have sex with me, if you don't do this with me, I'm going to out you. Or if you don't do XYZ, that's coercion, right? It's doesn't make it a choice if there's something worse that's going to happen. They may, because like say they're in a same-sex relationship, maybe they call their creditor and take out credit cards in their name, and because they are in a relationship, they have all their information, and their voices both sound like females or both sound like males. The creditor doesn't ask any questions, and so they take out bills in their name, or different things like that, or rack up credit card debt in their name. These things can look all kinds of different ways. um, they don't want to disclose to their community because they have all the same friend group, and they say, if I come out, like, they are going to choose my partner over me. There's so much more, X, Y, or Z. And, so that loss of community, because there are very small pockets of LGBTQ plus folks, that creates more fear and more isolation, for folks. So we know that the tactics may be similar, but there are definitely, some nuance that people may experience that we may forget, and also some added barriers that might happen because of their identity status and because of assumptions that people make. When I've done these trainings before and talked about screening, someone disclosed, I'm a lesbian, and the medical provider said, "Oh, you're a lesbian. You don't have to worry about domestic violence." That's really dangerous if people are making assumptions based on gender identity, or sexual orientation. So we need to, think about what those assumptions are, think about why we have them, and also, work to break those down so that everyone can be safe in their homes.
So we'll talk a little bit more about what those barriers to resource access look like for LGBTQ plus folks. As we've mentioned, stereotypes and biases around LGBTQ plus identity. So the assumption that abuse doesn't happen between same-sex couples, um, that may look like flat out denying that, oh, it doesn't happen in same-sex couples, or like these assumptions that, well, men are just aggressive with each other. So this isn't really abuse, it's just how men act, when that's not true. And that assumptions that LGBTQ plus individuals don't need certain screenings based on their identity. So the assumption that maybe a person who comes into the office who identifies himself as a lesbian, oh, well, you don't need any penetrative sex sort of screenings because you're not having that, when you have no idea what people are doing in their sex and personal lives, and that it's a question that you can simply ask. Lack of specific and culturally competent resources. So LGBTQ plus people don't have the safety that other people have in just assuming that resources are for them. So what I mean by that is, for some folks, walking into any old doctor's office, they might expect the same treatment that they got at their prior doctor. While for someone who is trans, for example, going into a doctor's office and not seeing anything that refers to trans healthcare or LGBTQ plus healthcare, not even a flag, might have them concerned that outing themselves to their doctor is only going to get them ridiculed, or their doctor isn't going to know how to give them treatment or talk to them. Abusers weaponize bigotry, like we said before. So telling people, victims, well, where are you going to go? All the shelters are for women. It's not true. But there are ways that people can lie and sort of intimidate that, you're not going to be welcome there. You're not going to be welcome with this resource. Fear in the political landscape, not only of, having someone's own rights being taken away, but, oh, if I disclose that I was abused by this other person that identifies as LGBTQ plus, that's only going to lead credence that this community is a bad community. It's not true, but that's the unfortunate fear that a lot of people have. And then the historical fear around medical professionals, not just from the AIDS crisis, but from just the way that queer people have been treated by doctors in the past, maybe even in that own person's particular personal past. And so all of these stacked together, mixed together, make it really hard for LGBTQ plus people to access resources. Everyone's personal experience and comfortability varies, but we just want to draw attention to that. But then there's the other side. How do we think about helping survivors? So one of the biggest things we can do is learning about and addressing oppression of one people helps all people. So in talking about LGBTQ plus partner abuse, this doesn't mean that things are just going to get better for LGBTQ plus people and everyone is left to the wind, but that when we work to make our community safer for one person, it's safer for everyone. So we all have our own biases and things that we've been taught. It's important to understand them and work towards unlearning them, and understand the power that you have. For folks here who are medical providers or work in this sphere, this is an access to resources, to knowledge that other folks don't have. And so in some ways, you are gatekeepers. And it doesn't mean anything bad. It just means something we have to be conscientious of. You don't have to understand people's identities. You just have to affirm them. So we all identify differently, even if someone checks all the same boxes as you, what it particularly means for them to be a woman or a man or trans or lesbian might be entirely different from what it means for you. And so we're not asking anyone to understand other human beings inside and out because it's just not possible, but to affirm people's identities and what's important to them. Learn about LGBTQ plus specific resources in your area. We'll talk about a couple. Validate emotions, including complex ones. Emotions rarely come in just like one little neat package. We often feel multiple things at the same time, A client may come to you happy that they're taking steps to leave an abusive partner, but also really sad because they missed like the good times they had, or something to that effect. Understand how you are and aren't equipped to serve LGBTQ plus individuals. So what are we doing good at my practice and what could we do better? There are tons of organizations in the state of Maine that can help practices and people learn and grow. So Out Maine, Equality Maine, Maine Transnet, certainly look into pride groups and alliances in your local area who might be able to help. And then one thing that we really wanted to highlight as well is the experience of LGBTQ plus folks, to sort of frame what we've been talking about today. So these two quotes are pulled from a study called Broken Down by Bias, Healthcare Biases Experienced by BIPOC and LGBTQ plus Patients. It was published in 2022. I got it via the National Library of Medicine. So this is a new study, and these are direct quotes from participants. The first is, I do think that it also comes with the power dynamic of like having more control as a doctor. As a professional, you can say like, I have all of these degrees and have all these years of experience, and you're just a patient. You don't have as much power in the situation, so they kind of have that control. Thinking back to the power and control wheel and power and control being in the middle, survivors of domestic abuse have their control over their lives taken from them. So trying to access a resource where the person who's supposed to be helping you also has control over what might happen is really scary. And so that's why we just try to continually be learning and unlearning bad things that might have come up for us, and helping our community as much as possible. And then this other quote is a little lengthy, but I think really important. I said, my partner has a penis. Does this affect this or that? And he laughed and said, oh, well, I'm sure your boyfriend, yada, yada, yada. It made me so angry because not only was he, I guess, for my body, I can justify it. And I can understand not everybody is super educated about trans issues or pronouns, whatever. I can excuse that even if it's not right to help me get through the process and minimize my discomfort. But as soon as he disrespected my girlfriend, I got mad and I just stopped talking, started giving very short to the point answers because I didn't want to get angry and I wasn't going to explain everything in the hospital again. So thinking about if this person had been a survivor, already feeling vulnerable with this person who has more accolades than you, potentially, who has control over what is going to happen to your medical resources, physically vulnerable in the hospital gown, and then also, is it safe to correct this person? I need help. I don't feel comfortable now, and so now I'm not going to ask. And so that's really the importance of what we're talking about here, that if we aren't creating spaces and resources that are safe for LGBTQ plus people, they're simply never going to get the help that they need. And it is a real barrier and really unfair. And so that's why we really want to talk about these things today. So thank you.
So we always want people to know that our services are available to everyone, people of all genders, all sexual orientations. We're here for everyone. We have our 24-hour hotline that people can call anytime to get support, to ask questions. For people who are currently experiencing abuse, or providers or friends or family members, we're here for everyone in the community. We have emergency shelter located in Kennebec and Somerset Counties. Again, our shelter is for everyone, people of any gender. We have court advocates who support people, through the court process of getting a protection from abuse order. We have a liaison to Child Protective Services. When CPS gets involved and there's an open case, that can feel really scary for folks. So this person they're sort of like an interpreter. They work with the survivor to navigate CPS, but they also work with CPS caseworkers to explain why things might be happening or the way they are, and just to help support advocating for that survivor. We have individual advocacy, so we'll work individually with folks to make safety plans, provide support, resources, just to listen, because sometimes when people open up, it's the floodgates are open and they just really need someone to listen and validate what they're going through. We have support and education groups. These are great because, hearing from another survivor what you're going through, it just can be really validating. And people in that group, it's really empowering. They're helping each other through what's going on and seeing people, who are going through the same things and getting through it. We have school-based educators, so going in, speaking to the younger ones about hands are not for hitting, all the way up to high school, talking about relationships and breaking up and all of those nuances. We do specialized training and consultation, and we also have certified domestic violence intervention classes. So for men, that program is called Change Work. For women, it is Respect Me, and we co-facilitate that with KBH. And again, I'll acknowledge that these are gendered programs. There is a lot of work to be done to build some nuance into these programs. So totally acknowledging that. And all of our survivor services are free and confidential. And then, go ahead, Victor.
That's it, really. So thank you all so much. If you have any questions, we'll stop the recording soon, but otherwise, please feel free to reach out to Michelle. I am wrapping up my last week here, so if you email me, it won't go anywhere. But thank you so much, folks, and have a great rest of your day. And feel free to ask questions.